Hello, good afternoon, everybody. How are you? Thank you for joining our webinar. I'm Rohit Mathur. We'll just give it a couple of minutes. A lot of people have registered for this webinar, and we are excited to have you here. So we'll give it a minute before we get started. And I see that people are joining. So just give it a minute. But welcome to the webinar. It's a little windy and wet day here in New Jersey. I don't know where you are joining from, but hopefully you have better weather than we do. The wind has picked up. So in the past, sometimes when the wind picks up like this, we always worry about power outages. So hopefully we are going to be good throughout this webinar. Otherwise, we'll have to deal with the weather as it comes through. But anyway, welcome, and we'll get this rolling. By way of quick introduction, Prabhat and I are co-founders of FieldWorker.ai, where basically we are trying to make the day-to-day life of care providers and caregivers and agencies easier. Prabhat is also a professor of computer science at NJIT. So today's topic is right up his alley from an AI perspective. Both of us come with family experience in disability care. So we are very familiar with the world. And you see that with the product, FieldWorker product. It's all about care, care providers, agencies, organizations, and caregivers. So today, the idea was we wanted to have a practical conversation about AI. What is it? What it can realistically do today? Where it can create some meaningful value for you, especially in human services where we are all engaged. And just as importantly, where we need to be thoughtful and cautious. So there is obviously a tremendous amount of talk around AI right now that all of us have heard. But for organizations in social care, disability care, elder care, families, maternal and infant, and others who rely on human contact, human services, the question is, of course, how do we use AI? But a more important question is, can AI reduce some of the administrative burden, the ever increasing administrative burden that we and our staff always feel? Can we give them better information and ultimately give them more time to focus on the people that we are delivering care for? That is the most important point. And can AI help the families, the caregivers, and also reduce some of the burden on them? So we'll talk about a lot of these topics where we think AI can help, responsible use, administrative burden, and how do we make sure that people remain at the center of care and we don't lose sight of that. So we'll also share a few examples, and Prabhat is going to talk about how we are approaching AI within FieldWorker. But ultimately, we want this to be an interactive session, right? We're going to talk, we can, of course, talk about a variety of topics, but we'd love to hear from you. So please feel free to ask questions. There is a Q&A here. You can use the Q&A. You can use the chat. Just drop your question in it, and we are happy to answer them now. Or you can also always reach out to us later. Prabhat, anything else you would like to add to that before we get started on the discussion?
No, I think you've said it right. I mean, as you mentioned, the whole idea here was to unpack what AI is, what it does, or what it can do, and then specifically in the areas where we act or we function, our users, our family members, our caregivers, where does it fit in? And then, really speaking, as you said earlier, in the sense that make it completely conversational. If you have questions, if you have doubts, if you have clarifications, anything that bothers you, minds or comes in your mind, should we use it? Why should we use it? Should we not use it? Feel free. It's all a conversation, a discussion. And as Rohit mentioned, that we will also try to touch base. What are we doing at FieldWorker? How we are trying to kind of make it so that you can get to use to it as much as you can.
Yes. And what one thing, if there is one thing I would say during this session, think about if AI could remove one task that is repetitive or burdensome to you, which will help you, your agency overall, what would you want it to be? Right? If AI could help you with one thing, with the most painful thing, what could it be? Please drop us that in a question. So Prabhat, maybe a good place to start is with the most basic question. When we say AI in the context of human services, what are we actually talking about? What is AI?
That's a great question. I mean, actually, if you think about it, what is AI in general? So many of us, I mean, if you think about it, we are working with computers. We are sitting at a computer. So you teach a computer to do something, that's where you're giving it an intelligence, right? So what we are saying is that can we make computers more like us or more closer to the way we work, the way we think? And that's what we say, okay, the machine is becoming intelligent or the computer is doing a lot more than we were doing, maybe a lot more complex work, maybe work that we have been doing and it's taking time doing it in a more efficient manner, maybe doing it in a way so that it frees us to do things that are more important. So that's exactly what the AI is. And I'm sure many of us may have seen it when you see on your most common social media application, be it Facebook or something, that it identifies you in a picture. The app identifies you in a picture. That's an example of an AI. When you're writing something, a next word is being suggested for you, whether you're searching on Google or somewhere. That's kind of an intelligence built in. It's kind of expecting that you are probably looking for this word, this phrase, this question. All of these are examples of small things where we are giving some intelligence to the machine and it's trying to help you do things that you do more efficiently.
Yes, that's a very good point. And actually, also to what Prabhat said, the computer suggesting the next word, or identifying your picture or location of where you are. Google, Facebook, they've been doing that. AI has been behind the scenes active for a very, very long time. We are just not been a lot of times aware of it, but it has been working in the background to help us do things better through our computers. So that is, but Prabhat, that leads us to this, right? So taking it one step further, what when we talk about AI in human services, which is where we are all engaged, what are we talking about there from a human services perspective?
Right. So, I mean, if you think about it or extend the examples that we took, we simply say that if it can identify, let's say, a face in a picture, then can it help me figuring out, did I do my work right? Did I write the note correctly? Can it identify that among our population, who's at risk? Can it identify among the people or among the employees who are supposed to be completing a report who has completed it or who has not completed it? Can it identify trends that we see that if somebody is missing their expected visits or if somebody has forgot to check out a visit, those kind of things? Because at the end of the day, we're asking it to do very similar things that AI has been doing in other applications for a long time. So whether it could be identifying a trend, identifying an anomaly, identifying something which is either incomplete or have missed. It could be something that's expected from a regulatory perspective. Somebody's writing a note, and then the note is not of the quality that may have been defined by regulators, may have been defined by the agency itself. So there's a lot of different ways the AI can be put to use.
Very good, right? That there are a variety of areas where it can help us. And if you could, in those areas, if you could identify what can AI genuinely do well today, is it where are the AI systems strongest? And again, keeping it in the context of human services, the areas that you mentioned. But if you were to say where can we do the best work using AI, what would it be?
So, I mean, there are different examples, and I think without going into too much technical details, there are various different kind of models, right? So, as I mentioned, that one of the few things that maybe many of us or some of us have gone on and looked at Let's say the when you do a Google search, it gives you the answers. Some of us may have used things like ChatGPT and answer the questions, right? So, two things, if you think about it, is that it can generate text for you, it can summarize text for you. So, things, for example, where we do actions or activities in our domain or area of work, whether it's um, support coordination, case management, home care, caregiving, or any of that kind of effort, it can help deal with large amount of data, whether we are trying to summarize it, whether we are trying to understand it, whether we are trying to ingest it or kind of like put it into the system.
Great. So, but that's fantastic. And we're talking about the areas that are the most burdensome for us: documentation, finding information that is buried in a lot of data, um, yeah, getting all the details of a client, summarizing individual records, things like that, which are very, very important for us as human services organization to do well. Large volumes of case notes that we are dealing with, large volumes of documentation that we're dealing with. All these areas, I guess, Prabhat, you're saying are beneficial from that perspective.
Yeah, I mean, if you think about it, there's really no limit here in the sense that almost every area there where our users are engaged in, where we have our product working in, can get benefited from the AI. It's the question of are we ready for it to be used? Because as I said, that there's always a cost associated with it. There are risks involved, and we should be aware of that. And one of the key thing, hopefully, that we want everybody to be aware after this webinar is where do you expect the AI to be? And in your organization, where you should drive maximum value, something that you already mentioned or asked as a question where you think in your organization, one thing where the AI could help. Obviously, we're going to come back with giving examples of all of these different categories that you have listed in here.
Yes, yes. And one of the other things that comes out about AI that is being talked about is, is it about reducing burden? Should organizations be looking at AI as a primarily as a way to reduce headcount, or should they be thinking about it differently? Where are we going to get help from AI from?
So that's actually a great question, and I think that's something that I hope every user, every agency should really be thinking about it. And let me start with what our position on this is. For us, the AI is a tool. It's always really helping you do your job better. We don't think that the AI replaces anyone or replaces work, basically. It enhances work. It lets you do your work more efficiently. It lets you do your work in a less time. It lets you do the work in a better quality. Now, that's exactly what we do. And I think as we go along, we'll see why we take that position. So, in a way, the AI is just like any other tool, right? Which is there to help you do whether you do work which is a back-end summarization of the information, whether it's the way to identify where the issues are or where you are improving the quality of the documentation, or you're trying to find out what's the next best action to take, for example.
Right, right. And in human services organizations, we always, the administrative burden and the type of work, all the way from intake, all the way to billing and maintenance is regulatory, needs to be compliant, and there is so much tasks that need to be done. And what you're saying is that across the board, there are benefits to be had from that in all those areas.
Yes, exactly. And I think when we look into, and this is something all of us should be thinking about for our own agencies in terms of what are the opportunities, what are the risks involved, and what are the value add that we are looking to create as we come along the lot of AI functionality which is being now provided, built into many of the systems that we have or applications that we provide.
And in that matter, right, since we're talking about all this information, right, uh, for AI to be useful in human services, does it need to understand the individual and all the context of information around that individual with the data that we have?
So, I mean, it all depends in the sense that just like any other person, in the sense that depending on the role that you allow someone to join in, that would be the case with when a new AI functionality comes in. How much should it know in that role? Does it need to know everything? Does it need to know a limited thing? So it all depends on obviously the context of the word, the term that you use. And as we go along and as we discuss the what's involved in the AI and what are the risks and how the risks need to be managed, or how do you pick one solution versus the other, and how we are performing in FieldWorker, we will come to see that what are these things that we are talking about, terms like context and the information and how much information should it know.
So could I ask a question like, what changed with this individual this month or this week and get an answer? Is that something I should expect from the system?
So yeah, right. So as I said, that we'll have to see a lot before it goes in the sense that how much do you expose your AI? Do you want it to know everything about the individual you're servicing? Is that AI secure or safe enough to know everything about your customer to answer that kind of question? And this is where it comes in that what product you're working with. Is that product taking all precautions before it gets exposed to all the data about your individuals, about their services, and things like that? So, theoretically speaking, yes, you can ask that question to a good AI system, and it should be able to summarize every individual in your system. It should be able to summarize what kind of goals that individual has, what kind of services has been provided to this person. In provided sufficient context, it can also help you determine whether the goals towards which the services are being provided are being met. Whether you are providing sufficient amount of service to make sure that whatever number of units being authorized for you, are you meeting those units? All kinds of information is possible to be derived via an AI interface.
That's very good. So much information. Now, there is a term that keeps popping up, right? We always keep hearing that uh, we should not give AI total control, and humans should always remain in the part as part of the process. And the term being used is human in the loop. And and some of our audience members might have heard this term as well, human in the loop. But could you tell us a little bit about what does that actually mean? And how does that relate to human services? What is that term?
Right. So one of the thing, and actually that's one of the reason why we thought that we will have this webinar to make sure that our users and everyone who's basically interested in our product is as much aware of AI and its related use cases. Um, the AI, just like any other system, has its own limitation and its risks. So one of the risks being is that can you fully trust it? Now, there are various different ways to deal with that kind of situation. Do you want AI to be a helper, or do you want AI to take a decision for you? Where we stand, or where as a field worker, what we are trying to do is be a responsible help, someone that would help you do your job better, but will not make a decision for you. One of the way the AI implementations or the systems have dealt with is called human in the loop. What does it mean? When you trust AI to do a job for you, it would basically give you information, whether it's a summary, whether it's a decision to be made, whether it's identified that you have a new individual who's being assigned to your agency, um, or let's say whether that humans Medicaid is getting expired and an action needs to be taken. Should the AI be just flagging what needs to be done, or should the AI be going ahead and doing it? Now, this is something which is a matter of trust. This is something which is a matter of making sure that the AI has been trained in such a way so that it does not take an action on its own. Many of us, those who are interested, may have heard, have come across the situation where the AI systems have gone beyond their original remit of what they were supposed to do. How they have been dealt with in a situation is always called like human in the loop. What we do is that whenever there is an action to be taken, our AI, what we provide as part of the field worker, will let you know that here's the suggested action. It would not take the action unless it's get a proper approval. So human is always aware of what action AI is proposing and why is it doing so. Yes, it might say then, if you approve, I'll take those actions. Now, where's the value then? The value is rather than an individual finding out 10 things to be done, AI is doing it for you, you're only approving it. And then rather than an individual doing those 10 things one at a time, it's doing it at a much quicker, faster, and guaranteed speed kind of thing. So that's what typically, as a risk mitigation exercise, that we call is like human in the loop.
Yeah, that's great. And what Prabhat is also from a field worker perspective, right? There are many areas where we have implemented this so that the work is done by the AI, and then it asks the human's approval to say, should I move forward, or do you want to make some changes here or suggestions here before you move forward? And then only then does it take the action. So human is in the loop is a very important concept, especially where in our world of human services, we are dealing with, of course, very sensitive information, PHI. We need to be HIPAA compliant, and those constraints and those parameters we always have to be cognizant of and work within them. And that is a very, very key point about this. So that leads us to the next point. But then, agencies, for example, receive ISPs, they receive, IEPs, they receive SDRs, referrals, all kinds of information they get. And that is where a lot of the work we notice goes in, manually reading those documents and entering information. So can AI help with that process? Is that something that AI can help with?
Yeah. So, I mean, yeah. So it's basically the same thing in the sense that what can AI do and what would we let us do in the sense, right? So human in the loop, before we come to that question, so I think let's just make sure that we all have understood the various risk parameters and how we kind of deal with those risks, right? So when we say human in the loop, that's clearly the action that AI is not taking any actions. It's basically suggesting you to take an action. Now, one of the use cases, Rohit, you pointed out, is a lot of manual work goes in basically getting information, whether it's the prior authorizations, where it's a service plan, or whether it's basically a new service delivery kind of a documentation or changes in the plan, which is either the goals or the services or maybe just the budget, right? A lot of work that goes into an admin. Can we trust an AI to handle this for us, right? So one of the key thing that goes into picking up an application of an AI or picking up a solution, that's also a very important aspect of it, especially for the people who have joined us here looking for help on how do you pick up a solution, how do you pick up a software. Um, does the AI work in a silo with your data, or do you upload your data into a larger ecosystem, right? So the short answer is that yes, it can help you work with all the data that you upload. But the key point, and I think we'll come back to it as we go along, is does your data go to the model? Can the model see it and use it for its own training, right? Now, as long as we make sure that the product that you're using does not use your data to train itself, does not expose or have a potential to get it exposed because you are uploading and providing your data to it. That's where the second risk that comes in dealing with giving the data, which, as Rohit mentioned earlier, we have a lot of um, PHI related data, right? So it shouldn't really go in there. So if you have an AI which is guaranteed to make sure that your data will not be exposed and or used for training, yes, there are solutions. We have a FieldWorker provide a solution that will take uh, most of the structured documentation that is required for social care organization to be ingested in a way that you take a PDF file. What you normally do is you have a 10 pages, 15 pages ISP that has the entire year worth of planning. It might take, if you want to put all of that information in the system, a couple of hours worth of time. You can upload that document, the AI, and within the field worker works through it. I'm not going to go into the technical details here, but basically goes through a 13 steps process, identify a lot of information that is needed or should be captured in the system, presents it to you as a user. That's the human in the loop. It can go start making changes on its own. It can actually update your databases. It can make changes to your authorizations, but it won't do it until you have verified it and you have confirmed that you want those changes to be legit. And then it goes ahead and then makes those changes. It reduces the admin work. It reduces the repetitive typing. It reduces the duplication of information. So a lot of information that needs to be entered in three different places, in three different systems, or in the same system in multiple places, all of that can be avoided because of a simple functionality that the AI provides us.
Yeah, yeah, yeah. And staying on documentation, which continues to remain our biggest burden for human services organization. So this is, can AI help someone write a better progress note or case note without actually writing the experience for them? So what I mean by that is that we want to write a better note, but we don't want to invent an experience. So AI should not be creating the note, it should be writing a better note. Can we do that? How do we control that? Or is that possible at all?
Right. Now, this is again this is a great question, and I think every agency and every caregiver knows that what they are documenting is their experience with the person they are providing care for. It is the reality, the most important work that they're doing, right? Now, there are certain expectations from the regulatory perspective. There are ways that AI can actually do it all for you. Do we want that to happen? That brings us to another risk that these AI systems have. Some of you may have heard this term called hallucination, where the AI is always it's basically a helper that's out there to please you. So if you wanted to do something, it would do it for you, even if it may or may not have happened or may not be true. It will invent things. It can invent things, right? So, yes, we want our users to be helped. We want them to be helped in writing their note so that it captures everything that they have already done in terms of providing service. Help them write a note so that it is in tune with what is expected from regulatory perspective, for example, right? So for I'll take the example again for what we are providing in field workers that when you're writing a case note, and let's say you have your um, individual service plan, which has certain strategies that you are employing in providing services. We have a functionality that would judge your note that you have prepared, whether it has included all the expected strategy, whether it has included all the expected uh, services that were provided, and it will identify where it's missing. As it stands, there's also a little bit of encoding, which basically tells you is the note good enough to be approved? Now, the definition of good enough can be different for each agencies. The strategies that they are employing could be different from one service provider company to another service provider company. Uh, the AI can actually help them rephrase their sentences or nudge them to say that hey, by the way, the service plan indicates that you should have used X, Y, and Z. You only mentioned X, Y. Did you provide Z? Have you forgotten to include in your note that you also did Z? So that is the kind of nudges where it will give you better case notes, reminding you what you did, and then present it in a way so that there's a good quality information to be shared with those who are interested in this work. So, great help in terms of improving the overall quality of the documentation and making sure that your work is not denied when it comes to the payment.
Yeah, and I just want to remind our audience here to please ask questions. Anything you would like to know, we are happy to take it here. One of the questions that has come up is that can we have a conversation with the data? So can we ask the questions? How does that work?
Right. Now, as we talked about earlier, right, in the sense that for many of us, people who are using it, as I mentioned earlier, a couple of different ways our first introduction to AI came. It could have come from identification of pictures or an individual in an image or in a picture, or like a chat GPT, where you are asking it a question, or even for that matter, Google search or any the other way. Most of us are very comfortable or familiar with a chat kind of an interface. Yes, it's definitely possible that we provide an interface where somebody can ask questions as if they are chatting to their assistant. They're chatting to an intern trying to get some things to be done. Now, that is, and again, a question that imposes, or that basically gives us an opportunity to talk about a third kind of risk that's possible in a way. Um, when you are asking a question about your agency, does it work within the remit of your agency, or does it go out and ask or give you the answers which are beyond that? Should or can you ask that question to a general purpose search engine like Google or ChatGPT? So this is where another concept that we have used here comes into the play. Your data is siloed. So those, if we are thinking of getting a product or a software that does it for you, and if that software material tells you that we train our AI on your data, I would say stay away from that, because they might be training, but then that data no longer stays with you. It becomes a public property at that time, right? So the answer to the question that Rohit mentioned after explaining what the risks are, yes, you can do it. There are ways to make sure that the AI is not trained on your data. AI is trained separately, but when it asks the question, it works with your data. What we do at FieldWorker is that we do provide an interface which is just like ChatGPT. We call it AI Companion. That is known, or that AI has been trained outside of your data. It doesn't work with any of the data that we have in FieldWorker when it gets trained. After it's trained, then it answers the question to you. At that point of time, it actually follows every single control that we have, our BAC, the role-based access control. As an admin, you can ask it question about any customer in the system. Your support coordinator can only ask questions about those customers for which he or she is working with. So if you think about it, the AI is capable of doing anything and everything that you ask it to do. It's up to us to provide sufficient guardrails. Some of you may have heard this term called guardrails, right? So it can answer questions about your customers, the services that's being provided, authorizations that have been provided to them, summarize the past interactions and things like that. Only your data within the access control, what's provided by the field worker.
Yes, and the term that Prabhat used, guardrails, is so key, right? Because our objective has always been and to put those guardrails around so that it's not going beyond its remit. It's staying with the information and it's keeping the security, the integrity of the data always. Uh, but this leads me to another question about asking questions. Can can the AI make it easier to use the software itself? So, for example, I'm completing a monitoring tool. I'm doing an EVV visit or whatever, and I encounter an error. Can I ask the AI for help?
Yes. Now, this is something that we are saying that we have an intelligent help available to you so that your easiest level of questions, let's call it the level one support, be handled by AI. Now, Android, you probably have been involved with a lot of users on the front end. We have seen a lot of repeated questions from the users, right? Sometimes there's a new concept. Sometimes they may just not remember how exactly it is to be done. Sometimes they may have a question of what exactly it is or what does it mean. We have provided in our software basically a support agent that can handle simple questions. You don't need to search through. We have extensive documentation, by the way, available. It can be accessed from the system. There's over 1,000 pages worth of documentation out there. Having an AI in front of it basically lets you interact with 1,000 pages worth of documentation by asking question in English or in a language that you understand. That agent then goes and gives you the answer as much as it can based on the product that you're looking at, right? So that's exactly what's the beauty. Now, again, don't want to throw it, but then some of us, some of the people who are attending may have heard something called RAG, retrieval augmented generation, in the sense that the data that it is searching for is explicitly provided. It is not hallucinating or inventing scenarios. It is not giving you a definition from a totally different domain. It's basically working on the capability, the functionality of our system, and then basically giving you the answer. So, yes, that's a great use case. And we hope that a lot of our users will find their answers using that AI.
And that's a very good point. And at the end of the day, the objective is for AI to help and support and be a very, very useful tool. But from an agency perspective, right? How can an agency begin implementing AI without creating another, like another technology initiative that becomes a problem? So that is something that agencies, human services agencies particularly, we want to keep, the care as the primary thing, and we don't want to worry about this stuff. So how do we manage that?
So that's a great question, actually, and it's something that almost every agency should be looking for. You're not, from the agency perspective, you're not looking for another tool. You're looking for changes that basically work within your workflow. So an AI should not be an additional step for you to do. An AI should be a component of what you already do, right? So that's the key thing that you need to think about. Is there a functionality? Is there a product that basically gets integrated in a simple manner? Sometimes you explicitly knowing it, sometimes you're not even realizing it. You may need to know when there is a human in the loop. You may need to know when you are summarizing and it is suggesting you to take some action. But clearly, it should not be an additional step in your workflow. It should be a step within your existing workflow that brings in efficiency, that brings in better quality, and without necessarily you learning anything new.
It should make the workflows that you already have easy, and
Correct.
and remove some of the roadblocks or some of the time-consuming bottlenecks that you currently face in those workflows, right? Because we want to keep so because all of us person-centered services are built around understanding the individual. So one of the things also that we worry about is there a danger that AI could make these services less personal? And I guess this is from that as well, that we are just the AI process is making your current workflows easier. It should give you more time to spend with the individual that is being cared for. And so it should help you even more keep the person as the center of care. Prabhat, anything else you'd like to add to that person-centered care key point that everybody is concerned about?
So one of the other use case, I'll mention it here, and I'm not sure it might have, it could come up as a question later on also, but let me just bring it while you mentioned person-centric um, view all the time. One of the areas in which we have devoted the AI for is in when you are handing over the care from one person to the other person, right? It should not the notes or the summary of the activity that's been done, or we're calling it as a shift handover. When you hand over a shift from one person to the other, um, your note should not be generic. Your note should be specific to that individual. What does that individual's immediate needs are? What was the way the earlier shift went in? We are using AI there to write you a better handover note, for example. So keep the person in mind, not have the AI do generic things, but be very specific and do it with all the guardrails, all the isolation or data silos so that the data is never exposed to anyone outside within the outside the FieldWorker platform.
Yeah, this is a very important point, and shift handover is something good that you brought over because what is important is we are all busy again. We're person-centered approach. So if a shift completes, we have to, let's say 3 8-hour shifts are running for an individual. The shift completes, the DSP, the care provider is exhausted, and at that point in time, to provide concise, detailed information to the next shift person is critically important, but a huge burden on the person who's finishing the shift. And so that is somewhere where the AI can help in helping write a better, concise briefing about the shift itself. So this is a very, very practical example of something like that. And this is something that again, a huge reduction on the administrative burden that is faced by the care providers themselves. There is so one thing I would say is how important it is for the leadership of an agency to demonstrate immediate value. Like, how do we show value to the staff so that from an agency employee perspective, it is not seen as something which is going to be, that adoption of this is going to create additional work for them, but it is going to actually help relieve burden. How do we expect agencies to do that?
So there are multiple different ways. Yeah. I mean, we can take a couple of different examples, and I'll go back to something that we talked about earlier. We have the ISPs, which is the service plans that come in. We need to make sure that we have to ingest them into a system. There's maybe a prior authorization that comes in. You've got to make sure that your services are mapped to the correct code when you are basically generating the claims to be sent to whoever is the payer. You've got to make sure that the service is mapped to the right code. There is an evidence of the service provided and things like that. You can take those documentation, and it might be somebody spending a couple of hours basically making sure that all the setups are complete in the system. With the AI, you can do the same exercise in a matter of 90 seconds. Obviously, after that, there's a human verification and you can do it. So you start from scratch. Let's say you have 50 new customers joining you or have been assigned to your agencies, or you are basically bringing the new customers in there. Setup that earlier might take a couple of days can now be done in a couple of hours. That's clearly the work. Yes, you brought it up here, like an onboarding agent, a document intake, extraction, and then making sure that the system is updated to bring in everything that's included there. And it's just not the goals, plans, strategy. It could be their contacts that are out there, the family member, their phone number, their addresses. All of those things can be ingested automatically in the matter of seconds rather than in hours.
Right. And also to add to that, right, because and a good ISP has a lot of detailed information. And so what ends up happening is, because again, due to the administrative burden of getting the data into the system and the time that it takes so far without the AI agent, sometimes agencies cannot get all that information into the system. So they just get basic information into the system. And then, the care providers, the care coordinators work with that, or they keep referring back to the document all the time, which requires them, again, to do administrative overhead. But with an AI agent, the ISP, the service delivery information, as Prabhat mentioned, can be ingested very quickly into the system. And now it's there. Every detail is in the system, which is not only saving the care provider or the care coordinator who was providing the services to the individual a lot of time, because this was not, they didn't have to enter this information, or some administrative person a lot of time, but also now this information, all of it, the contacts, the goals, the outcomes, the needs, the medication requirement, all the details which were in the ISP are now available to them at their fingertips, which earlier they would have had to refer to a document or some other system for that matter. So some of this data, just the sheer volume of data, automating and getting that in an intelligent format with human in the loop, has been really helping people do better care delivery, and spend more time with the individual. So this is quite amazing in that regard.
And another example, right, I'll mention here is the care companion, right? The
Yes.
easiest way for an agency to start seeing value in the AI would be, let's say an agency runs with working with 300 different customers or 300 different individuals who are being provided service. The AI care companion, you can ask them in the last week, are there any risks that have been identified? And it will tell you that here are the 5 visits that were missed. Here are the 3 other visits for which there is no associated documentation. So all of this comes to you in a very simple, interactive manner for you to take an action.
Yes. And again, it all comes down to centric, and making risk mitigation, making sure that we are delivering the best care. So I didn't realize we are actually kind of running out of time. I'm gonna but there are a bunch of other things. So, but where is all this going? If we were having this conversation again a couple of years from now, what do you think would have fundamentally changed how people are working in human services? Where are we going? And both from a general perspective and field worker perspective, where are we going with this?
So I would say that we are in very interesting times here. The technology has improved in the sense that there are a lot of things that are helping out the people or agencies which are working with humans, call them human service agencies, whether they are IDD individuals, where they're individuals that require long-term care in the institutional setting, care at home, all kinds of things, right? We should see from agency perspective the better quality of documentation, the better quality of the data, the reduced effort in maintaining the quality of the data. The agencies should have less load in terms of documentation or the overhead that they need to make sure that they get paid for what they're doing. The better quality of the data, the better documentation, making sure that there are no loose ends, basically is working towards one simple thing, that you get paid for what you are authorized for. So there's no money left on the table. There's no money left because the service couldn't be completed. There's no money left because the documentation is not in place. There's no money left because there has been errors in the claims that were submitted, right? All of those kind of issues can be taken or dealt with. At FieldWorker, we have a roadway that we are working on as far as the AI is concerned. We are making sure that there's always human in the loop. The data is never shared or never trained, or the model is never trained on your data. There's also that guardrails, which basically limits access to the data based on your role. So you ask the same question to the care companion, but the answer would depend on what you are permitted to see. So all of those guardrails are part of it, right? You ask the questions, where do we see a couple of years down the line? the caregiver should be less burdened. There should be hopefully better retention of the manpower. There should be a better quality of the service being provided. Hopefully, we get better individuals out there and they're satisfied with the service being provided.
Very apt. And this is all at the end of the day, the whole objective is to make services more human by giving our staff more time to listen, engage, and support the people. So in a way, AI is not reducing human interaction. It is increasing it in the right areas. So the human interaction is increasing with the individuals that you support and reducing it on the administrative side where we are drowning in all this administrative overload work right now. That is the objective. That is where we are working towards to automate as much as possible the administrative work that we are doing. And that I think should be the biggest impact of AI as we continue to implement, as we continue to improve, to reduce day-to-day operational overhead, the errors that sometimes creep in, providing more information to the individual, with the end goal being to give more time to support the humans that we are given to support. That is what we are. Any closing remarks on this, Prabhat? We are a few minutes over our time. But any closing remarks on this?
So I will basically mention two things here. Let's first take the easy things, which is really on the roadmap side. We are going to be having the newer AI modules, which will help us work with the social determinants of health. And if there is something in the community based services that are available for your individuals, your users, the people who are providing cares for, we will make it easier to search for those and then basically try to figure out where the help is easily available. Obviously, we have a consumer-facing app called Ability Hub that would basically be a key factor in that. The second part would be the various programs, various waivers, which may have been available to you. It's been not an easy thing to find out in terms of whether the individuals that are being serviced by your agency qualify for those waivers. We're building the AI that would basically let you identify which other waivers can be used to provide better services to your individuals that you're serving for. Easy part in the sense that that's the roadmap coming in very near future. I think in the longer term, it looks like that the AI is going to be with us. It's going to be with our systems that we are using. But the way to use it is really make it invisible. Have it work within your workflows, not become a task in itself.
That's a very key point. Keeping people at the center, helping them support. Great. Thank you so much. I apologize to the audience. There were quite a large audience that we went over our time window a little bit by 5 minutes. But you can reach us at, if you have any questions, if there's anything you'd like to discuss, our email addresses are right on the screen. You can reach us and we are happy to engage with you and answer any questions that you might have even after the fact. And help you in any way which we can. So thank you very much, everybody, for joining. And we look forward to talking to you further. Thank you. Thank you, Prabhat.
Thank you.